So we have here for the patient counseling information, it is indicated that it should be conducted with the presence of the patient. So the next one, we have the monitoring parameters. So for the hypertension, the blood pressure must be monitored, the heart rate and the rhythm, the renal function, fluid, and electrolyte levels for the sodium and potassium. And we have to assess for the signs and symptoms of dizziness and lightheadedness, including the photosensitivity reactions and skin cancer. So for the therapeutic plan, the food interaction, drug interaction must be included. So for this medication, um, for food interaction, it must be the alcohol may potentiate the orthostatic hypotensive effect of this thiazide drug when taken or drinking with this medication. So for the drug interaction, metoprolol may increase the plasma concentration with strong CYP2D6 inhibitors like fluoxetine, paroxetine, and the other drugs. So for hydrochlorothiazide, this may increase the risk of hypokalemia with steroids or the ACTH hormone. So it must be included also for the goal of long-term and short-term goal for this medication just to monitor the status of the patient. So for long-term goal, we have hypertensive treatment with this hydrochlorothiazide and metoprolol medication. It must be administered together because the purpose of this medication is to induce the lipid effects that deserve recognition, and in some ways, um, this might counteract the possible benefit of a reduction of blood pressure and the prevention of coronary heart disease. For short-term goal, we have to monitor this medical condition upon taking these drugs to achieve controlled blood pressure goals characterized by disorientation for time, medication, and lifestyle.
So, pharmaceutical counseling. So first, we have to make an open communication towards the patient. So we'll talk about his medication from past to current drugs that he must be taken. So adding thiazide diuretic to his existing prescription for antihypertensive medication. So we should inform the patient that metoprolol is a antihypertensive medication that treats HBP and irregular heart rate, prevent heart attacks, strokes, prevent chest pain by angina, and because of existing symptoms, he must take metoprolol with thiazide drug that lowers the blood pressure and increase the sodium and water excretion. So we should tell him that he has a stage 2 hypertension and it is okay to take thiazide with metoprolol, and with the patient diet low sodium intake, this will help to maintain his blood pressure. So these are some side effects of taking metoprolol and thiazide. It can cause dizziness or feeling like you might pass out, weakness, fainting, fast or irregular heartbeats, or loss of blood glucose control. So you should go to your doctor when you have these symptoms so the physician or the doctor can adjust the dose. But taking metoprolol and thiazide continuously for a long time, it may make the heart and arteries not function properly. So avoid drinking alcohol when taking these drugs. Also, follow the doctor's program like exercise, diet, and weight control. And lastly, do not stop taking the medication without consulting your doctor or physician.